After the maxillary final impression and before you start to collect mandibular information, you have to check if the teeth on the mandibular tray can be moved to the correct position without pushing hard on the tissue. If the occlusion of maxillary teeth has changed a little bit and the maxillary and mandibular teeth cannot get perfect occlusion, warm the mandibular Easdent tray in hot water, then push the mandibular tray against the maxillary Easdent impression to let the teeth occlude together nicely. To make it harden faster, you can let the cold water cool it down. Now you have maxillary and mandibular Easdent teeth occlude nicely. Put elastomers on the buccal hooks to hold maxillary Easdent impression with the mandibular Easdent tray together and put them in the mouth. Seat the maxillary Easdent impression back to the correct position. Let the patient bite down in centric relation until the mandibular tray touches the tissue at the first spot. Let the patient hold this position. Use Easdent measure to compare the pre-measurement with the distance from the lower border of the septum of the nose to the lower border of the chin. If the distance is smaller than the pre-measurement, you have enough room. You can go to record with moldable material directly. If the distance is bigger than the pre-measurement, or the tray is pinching at the tissue somewhere, you need to do adjustment first. Ask the patient anywhere hurting or pushing too hard on the mouth. You can quickly identify the location of the high pressure area by loading super fast bioregistration material in the area and seat the tray back in the mouth and let the patient bite down again. You can either grind away the show-through area or hit the area in the hot water and bend the area with your finger or let the patient bite down more to mold the supporting frame when the area is still warm. If the buccal or lingual supporting frame is too far away from the ridge, you can also warm the area in hot water and bend the supporting frame to adapt to the ridge better. Do not put the teeth in the hot water. It may change the occlusion with the maxillary Easdent teeth. Repeat the step until the distance is equal or smaller than the pre-measurement, and no supporting frame is causing pain in the mouth.